Hello everyone and welcome to the presentation of our paper called Pipeline of Anatomical Model Generation, Experience of Surgical Planning and Medical Personnel Training by Means of Virtual Environments and Physical Prototyping. The authors of the presentations are María Lucía Arango Cortés, Marta Lucía Velasco, Manuel Caicedo Ayerbe, Diana Sofía Herrera Valenzuela, Leonardo Steven Patiño, Federico Javier Núñez, Fabián Cortés Muñoz, Wilson Sarmiento, and the person who is talking to you, Carlos Latorre.
Let's talk about the schedule that we're going to use in the presentation. We have 4 points to treat: motivation, content creation pipeline, final remarks, and acknowledgement. I'm going to start with motivation. Currently, diagnosis images are a valuable tool to observe the internal structure of the human body. Thanks to the advances in technology, it is possible to have multiplanar and dynamic images from different structures, such as the heart. Here we can see some examples: the multi-detector, compute tomography, angiography, and three-dimensional ultrasound. The application of these technologies is related to diagnosis, monitoring, medical education, and surgical planning. The surgical planning aims to have all the information and anticipate as possible to the moment of the surgery and perform an intervention without any unexpected situations or complications. This project has been carried out in Fundación Clínica Chayo, a hospital and cardiovascular center located in Bogotá, Colombia. In Chayo, we have different highly complexity services for the treatment of congenital and acquired diseases. In the field of cardiovascular structural diseases, we perform different kinds of surgical and percutaneous corrections. Medical images are necessary to create surgical planning in these cases. In the average cases, we use 2D and 3D ultrasound, and in the case of complex cases, we indicate multi-detector compute tomography and angiography. The image from multi-detector computed tomography and angiography are a valuable tool for the radiologists in the diagnosis and communication process with other specialties, principally the surgeons, to collaborate and create a surgical plan. However, in some few cases, when the structural disease is highly complex and almost unique, may occur a gap in the communication between radiologists and surgeons due to the complications about interpret the 3D data in a flat panel display. Usually, the surgeons don't have the same skills to interact and understand the information in 3D as well as the radiologist. Consequently, it is possible that valuable information can be lost, generating disagreements during the surgical planning. Some alternatives that can help in the understanding of complex 3D anatomical information are the 3D printing and extended reality technologies. This work aims to share our experience in the use of these technologies in surgical planning activities. For the generation of physical prototypes, we use multi-material 3D printing technologies from Stratasys, and in the case of the virtual environment, we generate an application for the HTC Vive virtual reality system. The content that we implement in these activities was created by the use of materialized medical software. This information was carried out to 3D printing and extended reality. Over this time, several challenges and difficulties related to generating the appropriate clinical 3D content for extended reality and 3D printed models arose. As a result, we create a pipeline with the purpose of establish roles and produce 3D content with the appropriate quality and pertinence, suitable for medical professionals. During 2019, at Fundación Clínica Chayo, we used data from tomography tests performed on pediatric patients with complex congenital heart diseases and tracheal pathologies. This information was carried out to 3D printing and extended reality. A total of 12 patients were supported with these technologies during this year. Here we have a general description of our work. In the content creation pipeline, our pipeline is conformed by 4 stages where our contribution is mainly present in the 2 last steps. We also define the participation of the professionals in every stage of the process. The pipeline involves the image data acquisition from the patient, the image processing, complementary post-processing, and virtual reality setup. The data that we use in the description of this process corresponds to a 6-year-old male with a history of complete atrioventricular canal defect, abnormal right single ventricular physiology, transposition of red vessels, subvalvular aortic stenosis, disconnection of the pulmonary artery, aortic coarctation, among other pathologies. Data acquisition is the process to obtain a volume of information that corresponds to the patient's anatomy by the use of a CTA scanner. We use a thoracic protocol that involves an iodine-based intravenous contrast mediums to highlight the cardiovascular structures. In the picture, we can see the medical staff using a 320 slice helical CT scanner. The image processing stage allows for generating suitable reconstructions to transfer the information for the hospital, so then the radiologist can realize the diagnosis. The image processing stage allows for generating suitable reconstructions to transfer the information for the hospital, so then the radiologist can realize the diagnosis. In our case, the radiology technologist creates a multiplanar reconstruction with a distance between slides of 0.05 millimeters. All of this with the guidance of the radiologist. Biomedical engineers perform complementary post-processing. This stage involves the creation of more detailed 3D reconstruction and 3D models by using manual and automatic segmentation tools. The software used during this stage is Materialize Medical Suite. The segmentation can be performed in a single slice or on a 3D view. The final 3D model can be directly exported into a format compatible with 3D printing to create a physical prototype. The supervision of the radiology is absolutely necessary during the segmentation process. Define key structures, the adequate window level and window width, and perform some structure measures, if possible, are some activities that improve the quality of the 3D models. The following operations are performed to incorporate the final 3D model into the virtual reality system. First, we export the 3D model from the Materialize Medical Suite to a 3D modeling software to generate an FBX file. Then, we import this file into the scene of a video game developer tool. It is necessary to apply an adequate set of lights and shaders based on the preference of the surgeon. The scale is augmented to allow the observation of internal structures. Finally, we bring to the surgeon two options to manipulate and navigate the 3D model. Here we can see the surgeon using the HTC Vive system for the visualization of intracardiac structures of the patient that presents different kind of shaders to identify the key structures according to the diagnosis. Final remarks. The pipeline is the result of the experience of an interdisciplinary team performing observational exploratory activities. Their work aims to benefit the communication between medical personnel, primarily radiologists and surgeons. Here we have several challenges, but currently, the main challenge is to produce 3D content with the appropriate quality and pertinence. Another challenge, such as the interaction options, are also considered in future research. Further research involving clinical aspects is needed to validate the benefits of the extended reality in complex congenital heart disease. Different kind of research questions could be discussed today, but we start with the next questions. How could these physical models be integrated within the extended reality system in medical practices? How can the impact of this integration be assessed? Acknowledgement. This work has been found with resources from the Secretary of Economic Development in Bogota, Colombia, in cooperation with Fundación Clínica Chayo. We acknowledge to the departments of pediatric cardiology, cardiac pediatric surgery, radiology, pediatric intensive care, and the direction of clinical research at Fundación Clínica Chayo.